Welcome back to part 2 of the Michigan Pharmacy Law Review. Let us continue with the discussion of samples. Samples. The Prescription Drug Marketing Act, PDMA. 1. Ban the reimportation of federal legend drugs manufactured in the U.S. except when reimport by the manufacturer, or for emergency use. 2. Prohibits with few exceptions the sale, purchase, or trade of legend drugs by hospitals or healthcare entities or supplied to charitable institutions. 3. Requires states to license wholesalers. 4. Ban the sale, purchase, or trade in counterfeiting of drug coupons. 5. Ban the sale, purchase, or trade of drug samples. 6. Required the practitioner to request samples in writing. 7. Mandates storage, handling, and record-keeping requirements for drug samples. Michigan samples. Michigan calls it the complementary starter dose. Physician may delegate in writing to a pharmacist practicing in a hospital pharmacy within a hospital licensed under Article 17 the receipt of a complementary starter dose of drugs other than controlled substances. As used in this section, complementary starter dose means a prescription drug packaged, dispensed, and distributed in accordance with state and federal law that is provided to a dispensing prescriber free of charge by a manufacturer or distributor and dispensed free of charge by the dispensing prescriber to his or her patients. Mailing drugs. Michigan has no restrictions beyond federal. United States Postal Service mailing requirements for controlled substances. United States Postal Service's regulations permit the mailing of controlled substances by drug manufacturers or their agents, pharmacies, or other authorized handlers when distribution is lawful under DEA regulations and if the mailer or the addressee meets one of the following conditions. The mailer or the addressee is registered with DEA. The mailer or the addressee is exempt from DEA registration as permissible by law. United States Postal Service regulations permit mailing of any controlled substance, provided it is not outwardly dangerous and will not cause injury to a person's life or health, and if the following preparation and packaging standards are met. 1. The inner container of any parcel containing controlled substances is marked and sealed as required by the provisions of the CSA and its implementing regulations, and is placed in a plain outer container or securely wrapped in plain paper. 2. If the controlled substance consists of prescription medicines, the inner container is also labeled to show the name and address of the pharmacy, practitioner, or other person dispensing the prescription. 3. The outside wrapper or container is free of markings that would indicate the nature of the contents. Mailing drugs to foreign countries. The pharmacy may not ship controlled substance prescriptions to individuals in other countries unless registered as an exporter with DEA. Foreign countries also have their own restrictions. Controlled substance, CS, leaving and entering country. A resident of the U.S. may bring 50 dosage units from a foreign country on their person, declare it. A resident may leave with controlled substances supposed to declare, also entering the country may have restrictions. Medication guides are for drugs posing a serious and significant concern. Required for all outpatient dispensing original and refills if a medication guide is required. Risk evaluation and mitigation strategies may require it for inpatient. Be familiar with classes of drugs that require a medication guide like NSAIDs, antidepressants, long-acting/extended release opioids, etc. Not given it is misbranded. It is a required part of the labeling. Risk evaluation and mitigation strategies, REMS. REMS elements may include the following: medication guide/patient package insert, PPI. Communication. Elements to assure safe use. Implementation system. Timetable. Insert contains professional information. Can be given to the patient. Patient package insert. Required patient information for each dispensing original and refills. Institutions may do it as community pharmacies or with the administration of the first dose and then once every 30 days. Required part of the labeling. Patient package insert guide not given it is misbranded. Required for oral contraceptive drugs, conjugated estrogens not intended for oral contraceptive use, progestational drugs intended for oral contraceptive use. Consumer medication information. Not required to be given to the patient. Usually given with first fill only. Not regulated by the FDA. Pharmacies must follow the counseling requirements mandated in state and federal statutes and regulations. These requirements do not apply to drugs dispensed in nursing facilities that are in compliance with the drug regimen review procedures specified by the licensing authority. Offer to discuss. For every new prescription presented by the beneficiary, the pharmacy's representative must offer the beneficiary the opportunity to discuss/receive counseling from the pharmacist regarding the new prescription. The offer for counseling must be in a positive, helpful manner. If practical, the offer to counsel must be face-to-face and verbal. Otherwise, it is permissible for the offer to be made in writing or by telephone. Pharmacies are required to provide toll-free access for beneficiary inquiries related to products dispensed. The pharmacist is not required to provide counseling when a beneficiary or representative refuses the offer for counseling. Discussion. When the beneficiary or representative accepts the offer for counseling, it must be provided by the pharmacist in person, whenever practical, or by telephone and may include written materials. Information must be in a language that can be understood by the beneficiary or representative and must include an opportunity for questions. In addition to discussing interactions with drugs previously dispensed by the pharmacist, the discussion should also include the potential interaction with any other drugs the beneficiary indicates he is taking. The beneficiary or representative must be counseled in a confidential manner, consistent with any state or federal regulations. Federal law requires that the pharmacist must discuss all the items indicated below, and any others deemed significant in the pharmacist's professional judgment. If an interpreter is required, the provider must provide one free of charge. The name and description of the medication. The dosage form, dosage, route of administration, and duration of drug therapy. Special directions and precautions for preparation and use by the beneficiary. Common side effects or interactions and therapeutic contraindications that may be encountered, including their avoidance, and the action required if they occur. Techniques for self-monitoring drug therapy. Proper storage. Prescription refill information. Action to be taken in the event of a missed dose. This concludes Part 2 of the Michigan Pharmacy Law Review. If you found this helpful, please consider liking the video. See you in the next video.